Back in 2016, when I was at the practical nursing program, I had to learn how to take a manual blood pressure. At that time, it took me 2 weeks to master this skill. Nowadays, blood pressure is taken by a monitor. However, a manual blood pressure is more accurate and often requested by a healthcare provider after an abnormal reading from the monitor. I will cover in today's presentation the definition, facts, materials needed, and then proceed to show you how to take a manual blood pressure. According to the Medline Plus, a blood pressure measurement is a test that measures the pressure in the arteries when the heart pumps blood to the body. When you take a blood pressure, you get two numbers. One is the systolic, which is this top number, and the diastolic, which is the bottom number. The systolic is the pressure when your heart is beating, and the diastolic is the pressure when your heart is at rest. A normal blood pressure is considered to be less than 120 systolic and diastolic less than 80. An elevated blood pressure is considered to be between 120 to 129 systolic over diastolic less than 80. A hypertension stage 1 is considered to be systolic 130 to 139 and diastolic 80 to 89. Hypertension stage 2 is considered to be systolic 140 or higher and diastolic 90 or higher. A hypertension crisis is considered to be systolic higher than 180 over diastolic higher than 120. In a hypertension crisis, this is when you need to contact your primary healthcare provider. According to the CDC, in 2020, more than 670,000 people in the United States had hypertension as the primary or contributing cause of death. This is why it's important for you to take your blood pressure, as according to the CDC, hypertension often does not have symptoms. By taking your blood pressure, you can get diagnosed early on and get treated. In addition to that, according to the CDC, there are studies that have shown that hypertension is linked to an increased chance of getting dementia, a loss of cognitive function. The materials that I will need today is 2 tables. One is going to be for my volunteer and one for myself. And also I'm going to need a sphygmomanometer, which is this. And I'm going to need a stethoscope, which is this. I'm also going to need a volunteer to take their blood pressure. This is my volunteer. And as for my attire, I'm wearing a scrub, which is what usually healthcare providers wear when they take a blood pressure. I'm going to lower the camera so you can see the procedure. Okay, the first thing I'm going to do is ask for my volunteer to have a seat. Can you have a seat? And then feet flat on the floor. Put your arm on the table, your palm facing up. Just make sure that they're sitting up straight, which they are. And then you proceed to make sure to get the brachial pulse, which is around here. You do it with 2 fingers. Once you find that, you proceed to put the blood pressure cuff on their arm. It needs to be on a bare arm. Okay, make sure that make sure that you can see the aneroid manometer. To make sure if it's snug enough, you gotta insert 2 fingers between the bare arm and the sphygmomanometer. All right, then you proceed to put the earpiece on your ear, and the chest piece is gonna go where you found the brachial pulse. You're gonna hold this chest piece with one arm, and then you're gonna proceed to hold with the other hand. You're gonna hold the pump. This is the valve, and you're gonna proceed to turn this clockwise to close it so that you're able to pump. Then you proceed to start pumping between 160 to 180 milliliters of gauge. milliliters of mercury. Then you start to release this at about 2 milliliters of mercury. The first beat that you're gonna hear is the systolic, and the last beat that you're gonna hear is the diastolic. Give me a minute, I'm gonna take the blood pressure. Okay, I got the blood pressure. I'm gonna proceed to remove the equipment. And I'm gonna ask for my volunteer to be dismissed. Thank you. All right. The blood pressure that I got was 102/60. For the purpose of this presentation was to show you how a blood pressure is taken. And from this presentation, you gain knowledge about the definition, facts, materials needed to identify a blood pressure. And also, I show you the steps how to take a blood pressure. I hope this presentation helped you better prepare yourself for when your blood pressure is taken, or to master the skill of taking a blood pressure for someone else. Thank you.